So it was a pivotal day on Capitol Hill Wednesday for the nonprofit Bobbie's Breasties community. They're advocating for bipartisan legislation to close, a long-standing gap in the Affordable Care Act that affects parents, women impacted by breast and gynecologic cancers. Michelle Lampach is with us now. She's the director of impact at Bobbie for Change. So this is Connie's bill. Yes. Can you tell us what Connie's bill is all about?
So as you said, the Affordable Care Act will provide a lactation pump.
Yeah.
But if you've had breast or gynecologic cancer and are not able to breastfeed, you're not able to make use of it.
Yeah.
So we are trying to cover infant formula or donor milk in the case of medical necessity.
Yeah, and it's so interesting. I mean, I just had a baby a year ago.
Congratulations.
And thank you. And I got a free breast pump through insurance. And I didn't even know that. I was shocked because you look at the price of these pumps, they're expensive. And so you're like, wow, insurance is covering the pump. I never even thought about the women, the families who cannot pump, who cannot breastfeed. And so this is really important. What are, and I know you all had people with you on Capitol Hill yesterday going to lawmakers, advocating. Can you just talk about their stories and why they feel this is so important?
Yeah, I mean, we had a group, so we work with the Breasties, which is a nonprofit organization that's creating community for previvors, survivors, and thrivers of breast and gynecologic cancer.
Yeah.
And we at Bobbie have provided a year of infant formula to them.
Wow.
Because they don't have this coverage. And this program has actually been in existence for the last 6 years. We've provided 615 women with different lived experiences who are not able to medically breastfeed this infant formula. But we knew that the problem was actually bigger than breast and gynecologic cancer.
Yeah.
I almost say that it's like the gateway to this issue, but there are lots of people with medical reasons who are not able to breastfeed. But some of the stories we had in the room, we have a thriver who has metastatic cancer, stage 4, and she went through surrogacy and obviously was not able to breastfeed her daughter.
Yeah.
So we provide formula, but she came into the room because she knew it's also bigger than her, and she wanted to raise her voice and say, I'm joining this community and I'm calling on our government to do something about this, because it's not the private sector's problem alone to solve.
Sure.
We are working in lockstep in a marriage with nonprofits and hopefully the public sector on this.
Yeah, and I know so many families, so many women, need this support. And so for folks watching at home, what can they do to support you all if this is something they are also passionate about?
So, in the best version of democracy, someone who's impacted by a problem brings it to a greater group. You build a coalition, you bring it to your lawmakers, and you say, let's create a bill.
Yeah.
And that's what we've done.
Yeah.
And I'm so excited that after 6 years, I'm able to say that at 10 a.m. this morning, a bipartisan bill is being introduced in the House. And so now we're going to have a call to action. We've already brought 10,000 letters that have been sent to Congress on this bill, creating awareness.
Yeah.
But more than awareness, now we actually are going to have a bill that everyone can write their representative and tell them, let's actually fund this and get this done, and let's get it done soon.
Yeah. And so the hope of the bill is that the ACA will, incorporate this, and that, if you're a family who's not able to get the free breast pump through insurance, that you'd be able to get the donor milk or a certain amount of formula.
Exactly.
Yeah.
So we actually created this as a pilot program. So it would be 3 years. And it would live in HHS.
Yeah.
And so the idea is that HHS will figure out actually how to make it work, all the logistics. But that, yes, if you have a medical reason why you are unable to breastfeed, you would get some kind of coverage for donor milk and infant formula. And that piece about donor milk is so incredibly important. We want parents to have optionality on how they feed their baby. And we know that this is not a partisan issue.
Yeah.
Feeding your baby is absolutely bipartisan. It's essential to our existence, really.
Yeah, and it should be. And as a new mom, having that pressure of not picking out a $400, having to spend that money on a breast pump or being able to get the formula, or the donor milk is so important, because feeding your baby, as you said, should not be bipartisan, and it takes that stress off of the family. So, yes, we appreciate you, Michelle, for coming in and sharing more about that with us. And where can our viewers go to find more information on Connie's bill?
They can go to hibobbie.com/Connie's bill.
Okay, wonderful. Michelle, thank you so much. We appreciate your work here in D.C.